Hello and welcome to the Quincy Access Television Studios. I'm Mark Crosby. Thank you so much for joining me and my guest for Your Health. Today's topic is colorectal cancer, and my guest is Katelyn Kirby. She is a public health nurse in the city of Quincy. Welcome back.
Yes, thanks for always having me back.
Always a pleasure. You're always welcome to the studios. We should mention that this program does go throughout the country, so these topics that we discuss here naturally play well beyond the city limits.
Yes. I will provide at the very end all the resources we use, but today it's very much just to give awareness to the people. And I always love to say that to consult with your doctor when in doubt if you need more information.
Absolutely.
Yes.
Now, we all know that a lot of times a month is designated sometimes for one condition or another, sometimes multiple conditions, and that's basically what brought you to this topic today. Yeah,
so March is Colorectal Cancer Awareness Month, and we are actually seeing a rise in the age of where we're seeing this. It used to be at the age 50 you would start getting screened, but they have lowered that age range because we're starting to see it in younger individuals. So I just think it's very important to understand what are the symptoms to look out for and what does it even mean to be screened.
Now that you had mentioned that, I do want to bring up the fact that you probably grew up watching Dawson's Creek.
Yeah.
Did you? And the actor, one of the main actors, passed away from colorectal cancer. I think he was only 45.
Yes, devastating, very young, and a lot of times these you want to be able to detect this early because it is a treatable cancer, but again, it's making sure you detect it early.
So, as we begin our program, let's go over the overview for folks. So again, I know what to expect, and the folks at home know what to expect. We will start with a definition. What is colorectal cancer? We will talk about the symptoms, understanding risk factors, diagnostics for early detection, treatment, prevention, and, as you had mentioned, resources.
Yes.
And this type is perfect size for me. So, definition, what is colorectal cancer?
Yeah, so colorectal cancer is a cancer that starts in the colon or rectum, which are parts of the digestive system. It's the third most common cancer worldwide, accounting for approximately 10% of all cancers, or all cancer cases. It predominantly affects individuals age 50 and above, though we have been seeing it rise among adults between the ages of 30 to 50.
And as we had just mentioned, the actor at the beginning of the program, again, only 45.
Yeah, so it can be very it's always devastating, of course, but a lot of very young people are experiencing this. So that's why it's so important, because it's preventable. So that's why we like to come on and educate to show people what the symptoms are and what to look for, so that way you can prevent it and catch it in an early stage. Because again, this cancer is very preventable with early screening and can be very treatable at that point.
So let's look at the symptoms one might experience.
Yes, so the reason that screening is so important is because early stages often show no symptoms at all. So that's why a lot of times this can go under the radar. Especially, I feel like I'm in my 30s right now, and it's so just where I am in life. I know everybody's can be different, but we're go. We're working our careers, we're raising a family, so it's very easy to put yourself on the back burner.
And a lot of times you're young, and young folks like yourself, we almost think we're invincible. Or the younger you are, the more invincible you think you are.
Yeah, so it's very important to follow up with your doctor, really, at your annual visits, because they'll make sure you're staying on track with these sort of things. So those early stages, there could be polyps or colorectal cancer tumors without any signs. Some people may see changes in bowel habits, so that could be diarrhea, constipation, a narrowing of the stool, and feeling like you're not completely empty following a bowel movement. You may have persistent abdominal pain. So this is pain, nausea, cramping, or bloating. An unusual full feeling even when you haven't eaten much. You may see rectal bleeding. So there might be blood in the toilet, in your stool, or on the toilet paper. It's important to know, though, that could be something like a hemorrhoid.
Right.
Always follow up any bleeding. There should be no blood in your stool, so any blood in your stool, follow up with your doctor, or if you don't have a doctor, try an urgent care and they can direct you. People may have weakness or fatigue. That would go along with the bleeding. It's a sign of anemia, so that could be show that they have bleeding in their intestines. Even if somebody is very severely anemic as well, they'll also notice shortness of breath. And then
do anemic folks also have kind of a whitening of the nail?
it could, yes. The capillary refill wouldn't, if you low iron, it wouldn't fill as fast.
Right.
Yeah, and then also unexplained weight loss with any kind of cancer, you would see that as well. So if anybody experiences any unexplained weight loss, if it's been a month and you lost a good amount of weight and you haven't been trying, always seek advice from a professional. Yeah, so it's definitely important to know what to look for because again, you don't want to, you want to catch this early before it gets to the later stages, and then that's when the symptoms start to show up.
And I know we'll get to this, but family history is important with this type of cancer.
Yeah, so knowing your family history because the genetics play a very big role.
Absolutely.
Yeah.
Okay, understanding your risk factors.
Yeah, so the colon cancer screening age, again, has recently changed due to seeing it in younger individuals. So the United States the United States Prevention Service Task Force recommends that people at average risk begin colon and rectal screenings at age 45. So you are considered at average risk if you have no symptoms, you have no family history of colorectal cancer, and I did want to further go into that. The family history would be classified as having at least one immediate family member, so either your parent, brother, or sister, or child that's diagnosed under the age of 60, or if you have multiple second-degree relatives, so grandparents, aunts, uncles, that are diagnosed with colorectal cancer or advanced polyps before the age of 45. You want to make sure you have no history of cancer in general. You have no genetic links to Lynch syndrome, FPA, or other genetic syndromes. Genetic syndromes that a person may have that increases their risk for colorectal cancer. And the person wants to make sure they have no personal history of ulcerative colitis, inflammatory bowel disease, or Crohn's disease.
And that brings me to a point. I mean, you go see your primary care and they ask you, is there a history? And sometimes that individual might not know. So I guess stress how important it is to talk to your family about these things just because family history is important.
It does play a crucial role, and this all goes into why it's so important to follow up with a primary care doctor every year, because they look at this family history. If you don't know your family history, sometimes now they'll look at genetics, just your genetic history. But it's very important because by looking at your history and your family's history, it can show, it then will help you meet the criteria to be screened earlier.
And what about blood workup? I mean, blood workup that's done usually yearly at an annual physical. I suppose it could show anemia, correct?
Yeah, so they'll do like a complete blood panel on you. So they'll be looking at all of the levels in your body. So if they do see signs of bleeding, like a low hemoglobin, that would indicate they have to look further as to where you're bleeding in your body.
Okay, so diagnosis or diagnostics for early detection.
Yeah, so the gold standard is a colonoscopy. That's the preferred method. So a colonoscopy is a simple and safe procedure in which a doctor uses a long, flexible tubed equipment with a light and camera at the top, and they insert that into your rectum to look at your entire colon. There's also home test kits. So like there's a stool DNA and a fecal immunochemical test that can be done at home.
So is that the Cologuard?
Yeah, similar to that. So that you would test it at home, and those tests kind of will see if there's any blood in your stool, and then your doctor would then, typically you would do it at home by yourself and drop it off at a lab, and then your doctor will be able to assess the results and see if you need further. Because a lot of times a colonoscopy, people can be nervous to go in there. So some people can be hesitant, but again, I'm very one to, because people always think that it's embarrassing as well, but the people that you're going to see at these clinics and these hospitals, it's what they do for a living, and they're there to take care of you and to walk you through the procedure. So I always say try to leave like the feeling ashamed and all of that. There's no need to feel that way. You're taking care of yourself, and that's why you're there. But we also have like a flexible sigmoidoscopy, which is a simple procedure in which the doctor uses that long tube and light with camera just to look at part of the colon. We also have a double contrast barium enema, which is where they put a solution, they pump it into your rectum. I know they also can do, like, they have you drink it as well to look at it in your entire GI tract. And they take x-rays to look to see if there's any polyps or abnormalities. And there's also now a virtual colonoscopy in which it's similar to a standard colonoscopy, but they use x-rays and computers to make 2D and 3D images of your colon and rectum. And what they do when they're going in there is those colonoscopies, they will go in, and if they do find polyps, they may take biopsies to test them to make sure they're not cancerous. And depending on your test, they will advise you when to come back, whether it's an annual screening if you're high risk, or it could be every 2 years, every 3 years. It's very dependent on the individual and their risk history.
Now, could they, I suppose during a procedure like this, they could find what I guess is termed precancerous cells?
Yes. And they will basically, depending on your results, your team, your doctors will work with you on steps to take at that point.
I know one of the procedures has folks, as far as the prep, has folks drinking a liquid, basically to clean them out for the colonoscopy.
Yeah, so I'm happy you brought that up. My mom is a nurse, and she actually worked at Quincy Hospital, then Boston Medical Center, many years in colonoscopies. And she told me today, she's like, make sure you stress the importance of following the preps for these, because for a colonoscopy, it's a very strict prep you have to do. Typically it's 24 hours, no all clear liquids. It's very specific, like you can have some sorts of jello, but you can't have red jello because it can mimic blood in your digestive tract. And a lot of times people, if you don't follow the prep correctly and you go in for your procedure, they're probably going to have to reschedule you and make you come back in again, because if the doctor goes in there and you're not clear, they can't see anything. So it's very important you follow the prep. And if you have questions about the prep, check in with the facility where you're going, because they'll look at you specifically as a patient, because there may be certain medications they want you to stop for before the procedure and all of that as well. So those instructions before those procedures are very important to follow. And it's also because it can be hard to get an appointment. So if you're going in there and you're not fully prepped, when they reschedule you, it could be a couple months out, or it could be a year out. So keep in mind, you want to follow those instructions.
And we should mention that insurances cover most of these procedures.
Yes, because it is preventative. And that's what we love to see. We love to prevent things, because it's a lot more expensive to pay to cure somebody.
Absolutely.
Yes.
Okay, so treatment.
So treatment. So this I didn't get too in depth into it because it does vary on the person. So treatment depends on the stage of the disease, the tumor characteristics, and the person's overall health. So treatments include surgery, radiotherapy, chemotherapy, targeted therapy, and immunotherapy. So it's a very multidisciplinary team approach to take care of this. They also need supportive care in managing symptoms, relieving pain, and you want to make sure, like, it's a cancer diagnosis. You want to make sure you're supporting the overall person, their mental health, and their family's well-being as well. So it's very difficult thing to go through, and that's why we highly stress the importance of keeping up with those screenings, because you don't want to push this off and think, I'm healthy, I'll go to the doctors when I need to. Don't wait. Go to the screenings. You don't want to wait until the disease is already
because
there.
I think, and as you had mentioned, you could have no symptoms. So you may feel fine, and yet something might be off.
Yes. And there are also lifestyle, when we get into our prevention,
Which we can right now.
which we can get right into. So although when I did the risk factors, I very much covered like the genetics behind it. But with that, there are also lifestyle factors that can go into it. So several lifestyle factors that we see that can contribute to increasing your risk of development is a high intake of processed red meats and low intake of fruits and vegetables. A sedentary lifestyle, so limited activity, exercise, obesity, smoking, and alcohol consumption. So on the flip side of that, when we're talking about prevention, we're talking about eating well, exercise, avoiding alcohol and smoking cigarettes, and then really knowing that family history. And I thought it was very interesting because although there is those genetics, where we're seeing this in younger individuals in the population, it's believed that a lot of these younger diagnoses is more due to our diets. So not getting enough fiber, eating a lot of processed foods.
And we hear that continually. Processed food, it's not good.
Yes, and it's all over all the news, of course, all the different dyes and everything they put into the food. Hopefully over time that will hopefully be fixed.
And I think really, if you, I know your predecessor, the commissioner for the health department, Ruth Jones, had said when you go shopping, you should load your basket with colorful items. The more color, the better the food is for you. And we're talking about produce.
Yes, and also those outside aisles. The outside aisles where the fruits and vegetables, your starches, your dairy. You want to make sure that you're getting a lot of high fiber foods. A lot of the food we see out there today is eat this protein bar, eat this. Like, it's a lot of processed things. We kind of want to get back to our plant-based foods, so our vegetables, our fruits, our whole grains, beans, and legumes.
Beans are extremely, well, not string beans so much, I don't think, but baked beans are very good for you.
Yes.
And you had mentioned lentils are very good for you as well.
Yes. So definitely, like, you kind of want to get back to, like, support your local farmers market.
It's almost getting back to basics.
It is getting back to the basics, what you can grow in the ground. And really, for your meat, you want to make sure you're limiting your red meat. Make sure you're monitoring your cholesterol, your weight. So it's really just making sure we're getting good, healthy diets. And you want that fiber to really get your GI tract moving, because we need fiber for that. So yes, I think it's just very important that people are aware that we're aware that these screenings are necessary. Because some people, well, I don't have colon cancer, that never came up.
And I like the fact that you were, right, exactly, but I like the fact that you brought up that people might feel funny about going for these screenings. First of all, again, they're professionals that conduct these screenings, so don't worry about that. The other thing that people might think of is what the procedure feels like. And as a patient, you don't feel it because you've been put under.
Yes, yes. And they will talk to you beforehand, what, like, medication they can give you, like, for, to make sure that, I think it's kind of like a conscious sedation. So sometimes you may feel like you're aware, but you're not really aware of what's going on.
Right.
But again, they will walk you through it. So when in doubt, ask questions. And typically the staff will follow up with you before to make sure you have no questions about the plan to the prep before the procedure.
And we were talking about, when you were talking about eating well, obviously part of that, a big part of that, or the other side of that, is to be drinking well as well.
Yes, always hydration. Make sure you're getting your fluids in every single day.
And pay attention, of course, water, you don't get, other than hydration, you don't get other benefits from water, but there are juices you can drink. I suppose just be careful of the sugar content.
Yes, yes. Always read your labels when you're buying products. Even something like cranberry juice, like there's a cranberry juice cocktail that can be loaded with sugar. So always make sure you're reading your ingredients when you purchase anything.
And I suppose things like V8, which is a vegetable drink, again, monitor the sugar intake, because you can actually buy a low sugar, not alternative, but version.
Yes, a lot of brands are coming out with that, with lower sugar. And hopefully with time, our diets the products will be a little bit more straightforward. It's very difficult. You go into stores now and there's hundreds of boxes of cereal. How do you pick which one to have?
The other thing too, and I know the health secretary, Mr. Kennedy, had recently spoke about Dunkin' Donuts and the amount of sugar that goes into their coffees. And I mention that only because when I make recipes, when I use recipes, when I make, let's say, muffins, I cut the sugar in half and it's still fine. So people might not realize they don't need as much sugar as they're getting.
Yes, and especially something as big as that, where you're getting that every day, you're drinking a lot of calories. You're getting a lot of calories and a lot of sugar just through a drink.
Which can add weight.
Yeah, and that's not even your meal for the day. That's
Right.
just one drink you're having. So make sure you're aware of what you're consuming. Is the biggest thing.
So with that said, I suppose folks, I don't know how much, I don't want to sound like you should write down everything you have every day, but you should certainly be aware of, I guess, maybe your weekly intake.
Yes, yeah, and it's hard to, as with a toddler at home, it's so hard to tell you what I had yesterday, to be honest with you. But just day by day, you just try to make smart decisions. Like if you do love a large chocolatey frap from your local coffee shop, you can get it maybe once a week on occasion, but you don't want to be getting it every single day. So it's just knowing, like, you can have a piece of cake, but maybe not every single day.
Right.
Like it's
So
just
it's
moderation.
a treat, and it's
Yeah.
moderation.
Yeah.
And when we talked about kind of getting back to the basics, you of course have a young child, which you had just mentioned, and when my son was young, it was just the right thing. We felt the right thing to do is feeding our children carrot sticks, celery sticks, all healthy things, peppers.
Yes, it's so funny. For me and my husband, I'm like, we'd be fine with just local fast food, which is not good as a public health nurse. But now that our toddler's there, it's like, oh no, we're going to have carrots and chicken and broccoli. And so it's funny when you have a little one at home and you're feeding them. It's funny how you think so differently of what you're consuming.
Right, and most parents do begin by feeding their child or their children healthy foods. They really do. It's usually later on when they start to slip.
Yeah, because it's the convenient things. It's so easy to stop in a fast food line at the end of the day after work and school, and you want to get home and relax. But it's really putting like your better foot forward, and I think it's so easy for us to dismiss our own health because it's like, oh, I'm fine, I'll have a cheeseburger, it's not going to hurt me. But when you're taking care of someone else, you're like, oh, but I don't want it to hurt her. So it has, treat yourself like you're a toddler.
And you want to be around for your children.
Yes, so yes. And you want to make sure you're maintaining your overall health because it maintains your overall well-being. That's your mental health, your physical health. We are complex humans. So you want to make sure you're staying on top of all these screenings and your annual appointments to stay healthy and live a long, happy life.
And just before we close, let's talk about resources.
Yeah, so today's information, so a lot of it was from the Colorectal Cancer Alliance, also Mayo Clinic on colon cancer, and then the World Health Organization. So there are many resources, support groups. So when in doubt, if you watch today and you don't know if you have these risk factors, maybe check in with your doctor at your next appointment to make sure that you are up to date with your screenings.
Absolutely. Thank you so much. Again, great half-hour program, a lot of information, and please do come back on a different day with a different topic.
Thank you so much.
You're welcome. And thank you at home for watching. Please stay healthy. And remember to support the local access station in the community in which you reside. Take care.